Hello, I'm Dr. Thompson, Ntuba, Akwo, certified expert in global health USA, and I bring you updates on health and development issues of the day. COVID-19. We have a team of WHO scientists from multiple countries in the nation of China whose mission is to look at the origin of the virus or SARS-CoV-2 virus. And so they are in the city of Wuhan and other places. They have visited the virology laboratory. They have gone to the coal markets. They are looking at other areas of interest that will answer certain scientific questions, especially as it relates to COVID-19. And the government of China is cooperating fully with the scientists from the World Health Organization, with the officials in Geneva actually asking the international community, the international media to cooperate and allow them to do their job without criticism, without much talk, and wait for the report at the end of the day. Presently, we are talking about variants of the SARS-CoV-2 or the coronavirus that causes COVID-19. There are different variants. Some have been reported in England, South Africa, Brazil, and other countries. Now, people need to understand that when they talk about variants, some countries are very happy to talk about variants and name them based on certain countries. But let us understand that viruses in all countries can mutate, and those mutations can happen in situ, and there may be similar mutations that take place within your country that are taking place in other countries also. So we cannot be talking about the Brazilian variant in Chicago without also understanding that if Chicago is doing the studies properly, they may actually be called Chicago variants, and they have nothing to do with they've been imported from Brazil. But otherwise, generally, the scientists and the world CDC, Dr. Anthony Fauci of Infectious Diseases and Allergy Institute at the National Institute of Health in Bethesda, Maryland, are actually guiding and advising the world. The Public Health UK is also working. The German institutes and research institutes in South Africa, South America, in Asia, other parts of the world are collaborating to make sure that the world have an understanding of these variants, and tests are being done by the pharmaceutical companies that are involved in the production of the vaccines to make sure that they understand whether these mutants or variants can resist or reduce the efficacy of these vaccines. And so far, there has not been a very elaborate studies that says that the vaccines undermine the efficacy of this. The viruses undermine the efficacies of these vaccines. So the national vaccine plans in the different countries are going on. Most countries have a national vaccine plans in place, and the WHO made it clear last week that they already have agreements and contracts with certain vaccine companies like Pfizer, and that in February they will begin to ship vaccines to many of the MLICS countries, or the middle and low income countries. And we got requests, strong recommendations from frontline workers from Asia, from Africa, nurses speaking for healthcare workers, calling for governments to make sure that when WHO deploys those vaccines as of February to their nations, they will be given to healthcare workers first, because we know a lot of corruption goes on even in the healthcare sector in America. We hear authorities, frontline workers, and people who are leaders in EMS departments, doctors stealing vaccines when commodities are scarce, like we have these medical and health commodities being scarce today. Then there is the temptation for theft and corruption to take place. But sure, the institutions are in place to bring those culprits to book. So far, so good. We are expecting Johnson & Johnson and AstraZeneca vaccines to also get Emergency Authorization Act. The WHO made it clear that they are 1 year as of today when they actually declared the COVID or coronavirus pandemic a public health emergency of international concern. In the economic and development sector and aspect, globally, the World Economic Forum is also discussing some of these issues as they did last year in their meetings. And President Biden's international climate czar, Senator Kerry, or Honorable Kerry, has made it clear, has explained to Americans, to the world, why President Biden reassigned and recommitted the United States to the Paris Agreement of climate change. There are lots of people who don't understand what the Paris Agreement is all about, with the confusion of President Trump talking about the fact that they preferred the Pittsburgh Agreement, whatever that meant, to the Paris Agreement, as if to say the Paris Agreement had everything to do with France and Paris. No, Paris just happens to be the place where the world came together to sign an agreement that the world had decided to use in order to mitigate these dangerous health effects of climate change. We're having droughts, all types of problems, bushfires and related issues. So their climate or their health implications, their health consequences of a climate or a situation where the earth is globally warming and we are having the consequences, be the weather conditions, which have deteriorating effects on the economy, on the buildings of people that are destroyed. We had Harvey with the rains and everything and the flooding and how much was lost. So President Biden believes that the best way to address some of these issues is to return to the principles and provisions of the Paris Agreement, which came out of the United Nations. And so America has recommitted itself to the Paris Agreement under the executive order which was signed by President Biden, and which America's climate czar, the Honorable Kerry, explained in a press conference at the White House the other day. The almost $2 trillion